Okay, so we'll go ahead and call order this K through 12 and post-secondary mental health task force meeting. Glad to have the designee Dennis Barr for the education community to lead on behalf of education. I have my counterpart, Education Chair of the House, Rob Robertson, here. We've already had a number of conversations and talks about the legislation to put this task force together, along with some perceived goals we would like to kind of see come out of this. And so I'm just going to welcome you first, and as a first procedural moment here, also thank Ed and his group, Peer, for helping facilitate this, along with Leah Rupp Smith and her group at the Lieutenant Governor's office, and Rob Steven at the House for helping put this together. But with that being said, here either Ted or one of your staff, if you would please call the roll.
You could just say Fred. Dr. Baby. Senator Blackmore. Nicole Boyd. She's on Zoom. She's on Zoom.
Here.
Senator Bryan. Wendy Clemens.
Present. Jackson, Mississippi.
Okay. Representative Creekmore.
Here.
Dr. Damon. Dr. Etney. Heather Garrett. Dr. Hodge. Dr. Johnson, Emily Johnson. Sarah Jones. Dr. Medeiros.
Here.
Representative McGee. Heidi Nelson. Senator Parker.
Here.
Representative Roberson.
Here.
Representative Scoggin.
Here.
Kate McMillan. Linda Stewart. Julie Thornton.
Present.
Jonathan Tritley.
Here.
John Robert Walker. And Carla Weir, Dr. Weir.
Present.
We have a quorum.
Thank you. And we saw you come in just at the, so I think it'd be appropriate here to just, I know most of you should have the list of the members present here with some of their roles, but if we could, I'd like to just kind of briefly maybe start over here just to Ted's side, and if we could just work around kind of the ones who are seated here, and with the legislators, you know who we are, so I don't think we have to do any formal introductions unless unless Rob wants to give us a CV, in a narrative. But if we could, let's start here, and this, just kind of specifically, what your interests are, what we're going to go through some goals and things in a moment, but just hopefully what excites you about being a member of this task force. So please, and if you will, on the microphone there, if you'll just hold down the button until the light turns green. There you go. And then do the same to turn it off.
Okay. I'm Dr. Emily Johnson. I am a clinical psychologist that works with over 20 school districts in North Mississippi. And I've been doing that since 2001. So this task force is very near and dear to my heart, actually. So I very much appreciate all the work that you guys have done to get this going in one direction, and hopefully something comes out of it. That goes with that.
Very good.
Good afternoon. John Damon, CEO for Canopy Children's Solutions, and I guess we're the state's largest comprehensive provider for kids across all 82 counties with behavioral health, education, and family support solutions. And I'm super excited about this because we're talking about trying to take this mental health crisis to our kids where they are in schools, and to bring some real solutions for our education family out there, superintendents to teachers on the front line, to give them some real solutions and these kids support to thrive. Thank you.
Great. Thank you.
I'm Linda Stewart. I'm the Director of the Division of Children and Youth Services for the Department of Mental Health. Our DMH certified providers have a huge presence in the schools in the state already, so I'm really excited to see what we can do further to help here.
I'm Kate McMillan. I am the Director of the Office of Mental Health at the Division of Medicaid. I'm also a licensed certified social worker and very interested in just the holistic approach to mental health for our children, our families, looking for excellent resources, what we already have offered in the state, what we need to have to further the resources for our children in our schools. Just really excited for the opportunity to be here.
Thank you.
I'm Joy Hogue. I'm the Executive Director of Families as Allies. I happen to be a licensed psychologist, but I'm here as a parent of a child with a disability. And our organization is the only statewide organization run by and for families of children with behavioral health challenges. So we bring the lived experience of what happens when they try to get help for their kids. And I'm very grateful for this task force. And I know families are too, because I think families are typically grateful for everything that's offered, but what really helps may not be what's always offered. So making those things match better is a real exciting opportunity.
Great. Thank you. Dr. Edney.
Mr. Chairman, Dr. Dan Edney, the State Health Officer and the Executive Director for the Mississippi State Department of Health, also a board certified addiction medicine specialist, so have a lot of professional interest in this area. But as State Health Officer, knowing that mental health issues across the board are driving a significant amount of excess morbidity and mortality for the population of Mississippi, I have a significant concern. And then also very proud of the work that we're doing in the substance abuse space at the health department, and have partnerships with just about everybody on the list. So I'm so glad to be invited to be here. Thank you.
I'm Dustin Baker. I'm a board certified child and adolescent psychiatrist that works at UMC. I was invited to be here because we needed one. But I'm really excited to be part of this. Never got to do anything like this before. I'm pretty excited to kind of help maybe offer any insights that I might have just with training and experience to help guide any policies that might come out of this. I've run into a lot of families and patients who maybe experience gaps in the system where outpatient's not enough and all we have is inpatient to offer, and there's a lot of gaps sometimes that exist. And so maybe I'm hoping to maybe kind of take a look at those while we're here and see if we can't create more wraparound type services for some of these families and kids.
We'll skip over Senator Blackwell with his permission, unless you want to add a couple words. I know via Zoom we have at least a couple of legislators, and we've got, I believe, if my attention is correct here, I believe we have maybe 3 via Zoom who are non-legislators. If one of you just want to chime in and just give your perspective really quick, that'd be appreciated as well.
I'm Carla Ware. I am a licensed professional counselor and a national board certified school counselor. I've been working in those fields for the last 25 years. I'm the current president of the Mississippi Counseling Association, and that's how I became affiliated with this. And I'm a very passionate advocate for having services that are needed for mental health in schools.
Thank you.
My name is Melody Medeiros. I am the Executive Director of CommuniCare, which is Region 2's Community Mental Behavioral Health Center. We provide school-based therapy, outpatient-based therapy. We're opening an adolescent crisis stabilization unit for North Mississippi. And so I'm interested in this task force because I think we need everyone's help to stop adolescent substance use and adolescent overdose and adolescent suicide. And it takes a village. And so I'm just happy to be a part of this village. I'm also the president of NAMI Mississippi. So I also can bring some of that knowledge base with me. So happy to be here.
Great.
Good afternoon. I'm Wendy Clemens. I'm representing the Mississippi Department of Education. I've been in education for 34 years, so I obviously have a passion for students. The reason that I volunteered actually for this and am excited about it is that I believe that there are lots of resources out there for our children. But I think sometimes those resources cannot get into the four walls of the classroom or into the school. And so I really want to kind of serve as that liaison to help those quality resources get into the hands of our teachers, our counselors, our administrators who may not understand completely mental health, but hopefully we can help them recognize it and then find valuable resources.
I'm Jonathan Tritley. I'm a school psychologist that works down in the Gulf Coast. I'm also the ethics chair for the Mississippi Association for Psychology in the Schools. And I'm excited to bring any kind of insight in terms of what I see in the schools.
Thank you. Is there anyone else via Zoom or in the room who would like to share?
Yes, my name is Julie Thornton. I am the head nurse for Pearl Public School District. So I am there in the schools. I'm there at the high school. So I get to see day to day just how much mental health really does affect our students. Often work hand in hand with the counselors, and we do have resources that do come in and see our students. Telehealth has been a big help to students here recently. And so we're hoping that it will be another avenue to kind of bridge some gaps as well. So I'm excited to be here and offer any help that I can.
Thank you. I think we have one more or maybe a couple more making their way into the arena. And they thought they were going to get to sit in the spectator gallery, but that's not the way this works here. We'll start with our young man over here who had started his introduction.
Okay, hello everyone. I'm sorry for starting and also sorry for saying the wrong place. But hello everyone, my name is John Robert Walker. I am a recent graduate of Starkville High School and I'm about to go to school at Yale University. I have worked on the Mississippi State Superintendent Student Advisory Council, discussing several issues, and they all sort of tied back to mental health. And then this past year, I also served on the Mississippi Youth Council, working to address work towards equitable health outcomes for teens in Mississippi. And I'm really excited to offer the perspective of a young person because I think it's super important to include young people in conversations about youth mental health.
Hello, everyone. My name is Sarah Jones, and I'm a licensed LPC. I work at Jones College as Director of Counseling, and I'm excited to be on this task force to help us navigate different ways that we can help students at the collegiate level to be able to navigate life in a healthy way. So I'm excited to be on this task force.
Last but not least, I believe.
Hi, my name is Heather Garrett. I am a teacher. I've taught teaching Brandon Middle School, but I've been a teacher for 28 years. I have 4 children, I also coach. I'm very involved in my students' lives, and I've seen them suffer from mental health issues and different ways to help them. And I'm just looking forward to helping more of them that way.
Thank you. And one more. I think I'll share this morning. I got up very early to start my day early and prepared, was all ready. Got to the office, got on the elevator, and the power went out. And so I understand being a few minutes behind because that really changed my day quite dramatically. But I told Rob, I still made it, but I didn't make it in the fashion I was planning. So you are certainly excused for joining the table later, but if you would just quickly introduce, if you wouldn't mind.
Thank you very kindly. My name is Heidi Nelson, and I'm with the University of Southern Mississippi. I've been working for more than 20 years, serving the state of Mississippi to improve access to mental health care. I am excited to be here. Thank you.
Yeah, thank you. And just a few little points to kind of start here. Just some general points that staff have helped me kind of put together here. As background, in the last 10 years leading up to the pandemic, among children and adolescents, feelings of persistent sadness and hopelessness, as well as suicidal thoughts and behaviors, have increased about 40%. Research shows that this became much worse during the pandemic. All of this was on top of growing concerns about social media, violence, natural disasters, polarization and communication, plus the normal highs and lows associated with just growing up in general. Visiting schools across the state, the number one issue educators say facing students is a decline of mental health and the lack of skills which would allow them to learn, grow, cope, and succeed despite trauma. This translates to all sorts of societal harm, poor academic performance, chronic absenteeism from schools, lower graduation rates, higher crime rates, and ultimately less workforce participation. Those are all issues that the legislature has looked in very closely and trying to improve over time. This task force has been charged with looking into the laws in Mississippi now, the successes we've had in Mississippi, and also finding successes from neighboring states to try to find some recommendations to bring before the 2025 legislature. As someone who's been involved in several task forces in the past, the legislature takes very seriously recommendations that come from task force because they know there's a lot of information and time put in there. And so the hope would be that we get some degree of law change or direction that can move the state forward coming out of this. I'll also share that as a father, I have 4 children. I have 3 who are adults, and I have 1 who's 14 years old. And I will say that the 3 adults, as they went through their life and development stage, went through an entirely different stage than what I see with my 14-year-old, who is seeing a counselor, who is working through some things that are much different in today's world than before. So I find that as one of the reasons that I wanted to be involved. And that's one of the little passions I want to bring to the table here, because I do want to try to find some answers for this next generation, because they are forcing some differences as far as development and futures than what maybe some of our own children have faced in the past. And so that's just the background. And so that was my brief statement, which I guess is a fairly brief statement for me. And the next thing on our agenda was to seek nominations for chair. So what Chairman Robertson and I talked about after our discussions about the importance of this is much like we've done in other things, we are going to make the suggestion that we have joint chairs with myself as education lead from the Senate, and he is the House lead for education on the House to chair the committee. I think in that fashion, it might be better to allow you to excel in your work and not worry about the procedural elements of the meeting. That would be my suggestion. I'm certainly open to discussion on that, but it might make it a little bit easier to really get some things done with this. So Chairman Robertson, if you would want to add a few points to that too, if you wouldn't mind.
To echo some of the things he was saying, we want to be clear that from our standpoint, the House and the Senate are going to have to work together closely in making certain that these things pass. So we want to make certain that we are closely connected in everything that we're doing now. As we discussed yesterday, as a matter of fact, we'll entertain whatever this task force wants to do, but we do think that would be probably the best way to proceed with this, because we're the ones that are going to have to ultimately take this before the House and the Senate and make certain that this gets passed, and hopefully this will give us a pretty good way of approaching this. To give you a little background on from my standpoint and the reason I want to be here, I have 4 children, and it's interesting. I think I've heard it said a million times that each child is different, and there could not be a more true statement. I also have adult children. I have one that's in 2 that are in college and one that's going to PA school, but I have a 14-year-old as well. And I see some of the things that my oldest child dealt with, that the new things that are kind of coming along. It's really is kind of a different world. I don't know whether COVID changed a lot of things. I know as a legislator, I've had phone calls in the afternoon or even into the middle of the night. They're friends of mine that their child is attempting to self-harm. And there's nothing more debilitating as a father or a mother than your child try to do something themselves. You can't protect your child from themselves. And whenever I reached out to try to find help for these people that become friends of mine, I'll be very honest with you, I got very frustrated. I was as frustrated with the system. I was frustrated with how some places seem to have a desert when it comes to getting help for children. And out of that frustration, I think that having this task force come together and make certain that we're not just putting check marks beside things that we think are important, that we actually accomplish something. Because I do think as adults, we sometimes have a tendency to show up and go, whoop, I did that. That's not why I'm here. And if we can figure out a way to make this a little better, and if we save one child, this will be worth it. So that's why I'm here.
Thank you. And I think a shared perspective on our part will be beneficial, and we have our own little perspective, but we're really and truly, we want to hear what this group, has to say about the issue. We want to get the information. We want to have people in here who are coming before us and testifying and bringing us information that gives us a different perspective. If quite frankly, if we had all the answers, we wouldn't need a task force. And so that's why I think we've got a good group together, who can do this. So I guess procedurally, we would need a nomination from outside of R2, if anyone would be willing to make that. Dr. Edney?
Second.
Thank you. Are there further nominations from the committee? Seeing none, all in favor of the nominations as presented, say aye. Any opposed? Great, that'll let us get started with our work here. I will share a couple other little things here, on your agenda. It says brief statement again, which means, just bear with me. The task force kind of requirements, and I know you've probably already read through this a little bit, but procedurally, we're required to develop and report the task force findings by October 1st of this year. Majority of the membership is required to sign off on the final report. So we certainly want to get something together that we all are in agreement on, which is a challenge, having served in the legislature for quite a while, but it'll be a lot easier with this group than with 174 trying to come together on it. The meetings will be held at the Capitol, and like today, if you're not able to attend, I'll make the opportunity to attend by Zoom as well. But I do think that in person attendance will make such a greater impact, on the decisions and some of the points we're able to develop. We're charged to collect and analyze publicly available data and statistics related to the state of student mental health, to explore the impact of trauma and mental health issues on student behavior and their graduation rates and achievement, to evaluate currently available resources for addressing student mental health, including but not limited to partnerships with nonprofits or experts, telehealth opportunities, inpatient and outpatient resources, to review mental health training and professional development provided to K through 12 school personnel and school personnel at community colleges and IHL level, evaluate successful strategies for addressing challenges in student mental health in Mississippi and across the nation, review the current workforce landscapes as it relates to psychologists, nurses, counselors, behavioral interventionists, and others who work with schools, colleges, and universities to consider strategies to recruit the personnel needed for workforce change, explore the effect of a multi-tiered wellness program that is conducive to growth achievement, cultivating resilience, motivation, and culturally sensitive personnel development, and to review any other matters related to the above issues for student mental health in Mississippi. And so those are the stated, basically the kind of the objectives and goals as I see them from Senate Bill 2727 that initiated this task force. So with that said, I think just a few things that I know Pierre can help us with here. If it would be possible, we have the roster of members. If you haven't got away, or if Pierre could get maybe, a picture and name version of the roster together, that would be helpful, I think, particularly for some who are coming by Zoom. And then just some other things to maybe start thinking about are other people and resources that you would like to see involved in this process. I'd like to prepare maybe, a somewhat of a list of groups that we might invite, to come and just speak with us. I think maybe the best way to do this would be, based on time, maybe we can meet on a Wednesday afternoon, possibly stay over and meet again on a Thursday morning, if that might work with people's schedules. If it doesn't work with schedules, we're going to try to get those logistics type of things set so that it's reflective of what you can and cannot do. And certainly understand we all have different responsibilities outside of this. We'll try to get as much done in the times that we do meet, so that we're not just doing a little bit at a time. We'll try to, ingest as much as we can. And so with that said, just from the group, are there any recommendations on just procedural things or a flow that you have in mind that we can reflect as we're working with Ted and his group to kind of set the best guideline for this? Any comments from the group?
Senator Parker.
So we've got a deadline. So I would say it'd probably be a good idea to try to set maybe 2 in the shortest term frame to kind of just get some of the background going. So we'll start looking at dates in a moment, and then maybe coming out of those 2 meetings, look at, okay, how are we doing? How are we going? And not set it where 2 is going to be the end, but see how we're doing and what else we can add to the mix here. So that was my idea with my co-chair's approval. There was to try to maybe pick a couple of dates or potential dates that might work and work from there. I know, Senator Boyd, you had a comment. Senator Boyd?
Yes, thank you. Senator Parker and Representative Robertson, would there be a way to go ahead and allow the public to go ahead and submit comments in regards to this particular issue. But to have a public comment period. I know I've had so many phone calls from people across the state that had opinions about this, all good and concerned. So I think it would be a good opportunity to let the public write into Peer if that's possible. Thank you.
I think a good idea would be, I know one of our chiefs of staff for the lieutenant governor is very good at media relations. So if we can maybe get out, maybe just maybe a press release asking for that, and maybe direct the comment back to your office and to Peer, and we can start to compile that. I think that would be a good start. I thank you for that, Senator Boyd. Is a good idea, because the public awareness and the comment can be definitely beneficial here, and the stories and I've learned in being in the legislature a while that when we're meeting as a legislative body, it seems to carry more weight when we bring stories, or when we bring testimony from people who have experienced maybe the problems that we think are existing out there. That has a lot better ability at reaching legislators where we need to reach them, which is in their heart, than sometimes a document that we hand them with just some lists there. So I do think that would be a great, with your permission too, Ted, I think that would be a good reporting method for that. So any other great comments of that order? Yes. Senator Bryan, would you like to help her with the audio?
No, I've got some bamboo shoots over here. I'm driving them underneath my fingernails instead.
I was just thinking Senator Bryan was probably relishing the few moments I was quiet. That's such a wonderful idea about the public comments. That's great. I was also wondering, and this is probably true of other people in the room, I know like our organization has data that would probably be very relevant to this committee. What's the best process for sharing that? Do we share it with the chairs and then you kind of decide how it should be disseminated, or what would be most helpful?
So on your, I believe everyone has an agenda here, and we have Miss Deborah's email here at Peer. I think that might be a good point, to address, any type of volume of information and that kind of thing for review. And I would suggest too, in anything that you send, maybe start the email with your perceived value of the information, and maybe, if you have, depending on what the volume of information is, we certainly want to get this where the members can look at data in the most effective way. And so if you are sending in a 100-page manual, which is what I fear, some of the high points, or some navigation advice on how to reach that within the data, I think would be appreciated, so that we pull the correct nuggets out of there. Chair Roberts.
I think something that would be really important for me, because I'm short as well as short attention span. It would help to the experts, you guys that are invited to try to help. Remember, sometimes you will be talking to legislators, and we may not understand some of the jargon, the language. Try to make it as short and concise as possible, so that you're getting across your point, so that we can go and make the point, as we roll. Also, something that I think would be beneficial is, while we're doing this, tally up what is available in the state of Mississippi as far as this is concerned. And that may be something that's already started. But I know whenever I was looking for help, I ended up calling 5 or 6 different people, trying to tally up and figure out what was available out there. So I think that would be something else that, especially from your experts' standpoint, y'all know what's available. I can tell you, whenever you're flat-footed and you're trying to figure out what it is that can help a child out there, and you're trying to do this quickly, I think that would be really beneficial.
Any other comments from the group? So just in general, just, we can talk more about this later, but is the concept of maybe a Wednesday afternoon, Thursday, is that, does that meet most schedules in the room? And I know it's going to be a challenge, everyone in here in some way or another, but I think that might be, sometimes you get some information on an afternoon meeting, and then you think about that overnight, and then you have, an epiphany overnight, and you have more ability to share the next day on some things that have come to your mind after just giving it some thought. So if those days are agreeable days, let's just kind of look, just while we're here, and we'll get Pierre to send this out too. But I'm just going to pop up just the schedule ahead, because we have a number of, I think I've got some conflicts around here somewhere. Second here. So just kind of thinking a little bit ahead here. The one that jumps out on my calendar is maybe the 17th and 18th of July. Maybe the 31st and 1st of August, the 7th and 8th of August, as 3 kind of dates right there. Right. So maybe 17, 18 as a potential first meeting date, and then what we'll do on the second meeting is we'll try to communicate that by email and get some polling out there too. Because I do realize the first day or two of school, there are a few things going on, around that time of year in everyone's house. So 17th, 18th will be our tentative date for the next meeting. And are there any other comments?
Senator Parker?
Yes, sir. Representative, what can you chime in to help us with?
Well, I was just gonna ask you, you mentioned 17th and 18th. Are you talking about like 2 o'clock in the afternoon? Or are you talking about an all-day session, or what are your thoughts on what do you,
2 o'clock in the afternoon, to until maybe 2 to 5, and then the next morning, maybe, planning maybe, 8 to 11, something like that. If people don't mind starting early, that lets you maybe get back for your day and be able to do things after lunch. Yeah. So how does that type of timing work for most of you? That way you can, hopefully that will allow in all the things that you do, that doesn't take 2 days away from you. It just takes one morning and one afternoon away from you. I know we have, psychologists, and we have other people in the room here who have patient schedules and things they're working around. So I want to be as respectful to their schedules as we can. So is that okay with you, Donna?
Yes, sir. That's fine.
Great. Thank you. How about you, Rob?
I don't think we have a choice. I think we're going to have to, we're going
Right.
to have to do something to get it moving. So yes.
Right. So with that, if there are no more questions, is there a motion to adjourn? No motions. So we'll just stay and let's start over. So we got a motion to adjourn. All in favor, say aye. Any opposed? Great. Thank you.